Is inflammation in your gut actually making your hair loss worse? I'm a board-certified dermatologist, and the answer may surprise you. I'm Dr. Mina. Welcome to my YouTube channel, The Skin Real, where I give real people real education and information about their skin health so they can make informed decisions. Sound good? Let's dive in. This is my weekly recap video where I give you my key takeaways from my podcast recording of the week. This week, it was Hair Loss, It Takes a Village with Dr. Orlinsky and Dr. Simmons-O'Brien. And I would definitely recommend checking out the full episode. Be sure to stick around to the end of this video where you can check it out. So not a day goes by when someone is not asking me about hair loss, whether it's a friend, a family member, a patient, or even myself, as I've started to notice some thinning around my temples and my forehead. And I used to think hair loss was something just men struggled with and that it wasn't even that big a deal. And then I came to realize that no, actually women are also really distressed by hair loss, and maybe even more so because for women, we associate our hair with beauty and femininity. And when we start to lose it, it can really affect our psyche. And spoiler alert, everyone is going to have hair loss if you live long enough. It is just something that happens. So if you start out with thicker hair to begin with, it's going to be less noticeable than if you started out with thinner hair as well. But this is something that is pretty universal and common, that we will experience hair loss with aging unless we do something about it. Now, even though this is a natural process of aging, there are some things we can do to help it, especially if your hair loss seems to be accelerated. First things first, you start noticing hair loss or hair shedding where you're noticing increased clumps of hair. The first thing you want to do is take a deep breath and remain calm. I know this can really freak people out. It can be really scary to see lumps and balls of your hair in the shower, but take a deep breath and then schedule an appointment with a board-certified dermatologist, preferably someone who really focuses on hair loss and that it's an area of expertise for them. Now, when you go see your dermatologist, make sure that your hair loss is not an afterthought. A lot of times people bring it up as the exam is finishing or the visit is ending. And this is really something that needs to be front and center. It can take a long time to really ask all the right questions to try to determine why you're having hair loss. So if you're concerned about hair loss, make an appointment just for that so you can spend the whole time talking about it. Your dermatologist is going to ask you a lot of questions. Sometimes it may even feel like an interrogation, but bear with us. We want to know what's going on in your health, any new changes in your life or stressors, new baby, new job, a divorce or death. We want to know about any new medications, including supplements. And we also want to know the dosage that you're taking of different things. And we are going to ask about other medical issues that may be going on or other symptoms you may be having. Because number one is to rule out an underlying medical condition, because these conditions can cause hair loss not uncommonly. Whether it's hair loss from a nutritional deficiency, maybe low vitamin D or iron or ferritin, or abnormal thyroid levels, could also be due to autoimmune conditions, things like lupus, and lupus has a variety of different presentations, or other autoimmune conditions. So it's important to first and foremost rule out an underlying medical condition. Your dermatologist is also going to ask you about your diet, things that you're eating, your nutritional status. Are you struggling with things like constipation or maybe diarrhea or irritable bowel syndrome? Because believe it or not, your gut microbiome affects so much. And we now are understanding there is this gut, skin, brain axis where they're all connected. So what's going on in your gut affects your skin and affects your brain. And making sure that you are eating a good diet, lots of healthy fruits and veggies and antioxidants and lean proteins. These are going to be so important, not just for your overall health, your skin health, and your hair health. And it's also going to affect how you can absorb your nutrients, including supplements. So if your dermatologist starts asking about your gut health, don't be surprised. There's definitely a method to the madness. Next, your dermatologist is going to want to evaluate your hair and your scalp. And if you have a certain hairstyle or extensions or weave in your hair, it may not be possible for your dermatologist to do a full examination at that time. And they may actually ask you to come back when you have a hairstyle that's more amenable for a full evaluation. But what they're going to be looking for is, what does the integrity of your scalp look like? Is your scalp red? Is it flaky? Does your scalp look inflamed? Because if the skin of your scalp is irritated and inflamed, it's hard to have healthy hair. They're going to be looking for signs of scarring, maybe patches of skin where you no longer have those little hair follicle openings, that they are gone, any sort of pigmentation up there. And they're also going to do a hair pull test. And I know this freaks people out because when you're struggling with hair loss, the last thing you want someone to do is then pull your scalp and remove more hair. But there is a reason we do this, because it's important to know about the structure and integrity of the hair follicles that you have. And it's important to know whether your condition is truly from hair loss, where you no longer have hair follicles or you have miniaturization of your hair follicles, or if you have increased hair shedding, where the hair is just abnormally falling out too quickly and going into that telogen phase too fast. Your dermatologist may or may not do a skin biopsy. We don't always need to do that when we're evaluating for hair loss, but sometimes it is a good idea to do a biopsy or even a couple biopsies to determine what is going on under the microscope. And your dermatologist will probably ask you about recent blood work. Now, if you've had some of this blood work done by your primary care doctor or OBGYN, we may ask that you send that to us. A lot of times there's blood work that hasn't been tested for that your dermatologist may want you to get, including evaluating for iron levels, ferritin, thyroid levels, perhaps some hormone levels as well, if there's signs of that. So there's some other blood work that may need to be done as well. Now, once the investigation into your hair loss is underway, it's important, of course, rule out a medical condition, try to reverse that, rule out any nutritional deficiencies, try to correct for that. A probiotic sometimes can be a great option. Now let's talk about some of the treatments, because nowadays there are a ton of treatments for hair loss, and believe it or not, they actually work. Now, the tricky thing with hair loss is that a lot of times it takes throwing the kitchen sink at it. So not only does it take a village, it takes the kitchen sink to help it. It's not a quick one-size-fits-all fix. So a lot of people are really into supplements, and there's some really good hair supplements on the market, such as Nutrafol or Viviscal. I wouldn't recommend taking biotin. Nutrafol actually has biotin in it, and studies have shown that biotin is actually not that helpful in hair loss, and what it can do is actually cause some abnormalities in your blood work, looking at things like thyroid levels, pregnancy test, and really concerning if you are seen in the emergency room because of a concern for a heart attack, it can actually mess with those labs. The other thing is sometimes people are taking tens of thousands of micrograms of biotin without knowing it because it's in different supplements that you're taking, and on their own, it might not be that bad, but when you're taking 2, 3, or 4 of these supplements, it can really add up to high levels. So I would not recommend taking a biotin supplement on its own, and you do just want to make sure you know how much you're taking in all your other supplements. I think a big vitamin that is missing for a lot of people is vitamin D. And the reason for this is that it's difficult to synthesize in our skin, and it's also difficult to find foods that have high levels of vitamin D in it. So rather than going out and trying to get a sunburn to increase your vitamin D levels, get your vitamin D levels checked with some blood work first, and then supplement afterwards as needed. And again, go with your doctor's recommendation on how much you need to take to actually have it be beneficial. And lastly, there are tons of procedures now that can help. It used to be just hair transplant or nothing, or a wig or a toupee, but nowadays we actually have some treatment options that can work really well. One of the options I really like are taking oral pills like minoxidil, finasteride, dutasteride, even spironolactone in younger women. These can all be great at helping prevent hair loss and actually increase hair volume and the thickness of hairs. And most of them have minimal side effects, especially at such low doses that we are typically prescribing for them. Topical minoxidil, which is also called Rogaine, can be great. You can use it on eyebrows, you can use it on your scalp, but it can be a little cumbersome if you are really trying to treat full head hair loss, but it definitely does work. You just have to do it typically twice a day, the 5% variety, and it can help. Other things like microneedling, using a retinol before your minoxidil, even things like rosemary oil have been shown to be helpful. I personally like platelet-rich plasma injections into the scalp, which is known as PRP. This is encouraging our own growth factors to help stimulate hair growth, and it really can help. I've used it on myself, and I really do notice a difference along my temples where I did have some hair thinning and recession. Other popular things that people are doing for hair loss include red light therapies, either in the office or at home. And of course, there are tons of stuff being looked at from exosomes and stem cell therapies and a lot of stuff coming down the pike for hair loss. So I think this is something we are going to see tremendous growth in the next few years with treatments and procedures that really do move the needle, that really help. And I know that these treatments can really be so beneficial for my patients struggling with hair loss. And hair loss, it's really something fairly universal that most people in their life are going to struggle with. If you want to check out the full episode with Drs. Orlinsky and Dr. Simmons-O'Brien, where they share so many more pearls on treatments and things that they use in their clinic, be sure to check out the link here. And follow me at the Skin Reel for more great skin and hair education. And I will see you next week.